All right. What's going on, everyone? It's Dr. Calvin. We are live right now. I wanted just to answer some questions. I had some pretty interesting questions come back after the last live stream that we did, or the last webinar. We talked about, and some of my posts lately, because I talked about shoulder pain, and I have talked about how shoulder pain can sometimes be caused by a thyroid challenge. So I got some quite interesting questions coming back. So I just want to dive right in and answer these questions. So one of the questions that came back, this question says, so what's the deal with shoulder problems and the thyroid? Are all shoulder problems caused by the thyroid issues? No, it's not. The reason why, I forget, maybe it's one of the videos, but every muscle has an organ relationship when we talk about muscle testing. So there's about like 560 muscles that we can test in the body, right? There's not that many muscles, but there's that many different divisions. But every muscle has a different organ that it relates to. We found that out through acupuncture, through Chinese medicine, through Eastern medicine, is that in the acupuncture system, the thyroid triple heater or triple warmer, that is going to be affected, or that's going to be related to the external rotators of the shoulders, specifically the infraspinatus, teres minor, I believe. And then there's also other muscles in the shoulder that are going to be related to other organs, such as lungs. Right? Lungs is related to deltoids, the serratus anterior. The brain is related to the supraspinatus, right? All these different muscles in the shoulder girdle. There's so many of them. And it's not, so to answer the question, no, it's not just all thyroid issues. And it's not just all organ issues. Just because you have a weak muscle or a muscle that it's inhibited, it doesn't function well, it doesn't mean you have an organ issue, but it potentially can be, which is why it's important for us to check, because how many times have people, including myself, we've gone to many different practitioners and we've only looked at the structural piece, which is if there's a shoulder problem, well, let me do all the therapies I know on the shoulder. And sometimes that's not enough. A lot of times that's not enough. So again, there's always three things that cause anything: something structural, something biochemical, and then something emotional. So I hope that answers the question, is that not all shoulder problems is caused by the thyroid. It could be caused by any of those three issues, or all three together. Second question that I have is going to be, how does muscle testing differ from the other therapies like grafting, scraping, guasha, Eastern electrical stimulation, and soft tissue therapies? Good question. It doesn't differ. It's not a therapy. Muscle testing is not a therapy. It is a diagnostic tool. It allows us as doctors to be able to find out what is not functioning well in the body in real time, specifically with muscle. And not only is this brilliant for athletes, but it's especially great for those who have been dealing with chronic illness, chronic issues, like gut issues or whatever, that haven't found an answer to their problem. Or if you're an athlete and you have an injury and you haven't found an answer to whatever injury that is going on, or you're not able to break past the plateau and you don't understand maybe why biomechanically you're not performing as well as you can be. So it doesn't take away from all those amazing therapies like grafting and scraping. I love getting it done. I love getting soft tissue therapy done. And I do it myself too. As a chiropractor, we do these things. But again, it's the right thing done at the right time, which is important, because the right thing done at the wrong time is still the wrong thing to do. But I'll tell you a little bit about this, something further on in the next couple of questions. So I hope that answers the questions. That it doesn't take away from it. Muscle testing is a diagnostic method. Next question is, I have a problem with rounded shoulders, and it's always causing tightness in my neck, shoulders, upper back. Also gives me headaches sometimes when I work at a desk for too long. Um, how does this help with me with that? Well, rounded shoulders is a very common issue, and we want to think about it as like your shoulders round forward, but we think of that as tight pecs, right? The muscles in the front are are squished together, are shortened, so now they're tight, right? We call that like upper cross syndrome. And here's another thought is that maybe they're tight, yes, but does it really warrant for us to go in there and dig and release tension? Maybe it does. But here's what I'm proposing is that why don't we look at the muscles in the back, in the upper back? So if our shoulders are rounded forward, well, what's going to unround them? What's going to open them back up? It's all those traps in the back, upper trap, mid trap, lower trap, rhomboids, right? All these muscles in the back are going to allow us and posterior deltoids to retract our shoulder blades, right? To squeeze our shoulder blades together, to open back up. Maybe those are not functioning adequately. Maybe those are weak. Maybe those are inhibited for whatever reason. It could be either structural, biochemical, or emotional. That's causing weakness of those muscles in the back. So we can release this. We can release these muscles all day long. Get on a ball. I do it all the time, right? Get on a ball, right? You get something, jam it in there, stretch and stretch, and it doesn't seem to. It helps momentarily, but it doesn't completely get it fixed. And the reason why is because there's muscles in the back that are not activated. If we activate them in the back, the muscle tension will even out. Whatever is shortened, go in there and do soft tissue work. It's going to make things so much better if we do that, if we combine the two, muscle activation and soft tissue work, right? Muscle activation, there's many ways of activating a muscle. We can do something physical. We can adjust the spine. We can do soft tissue on things. Um, you can clear out emotions. Right? We can find out what nutrients are responsible that the body does not have, that's deficient, or there's too much toxicity. There's just too much to say. So that's why we test. Test all these muscles and all in different ranges to see exactly what's going on. So I hope that answers a little bit about it. And the concept is just like, think about like a tug of war, right? Or like guide wires. But imagine me and you are like playing tug of war, right? And if we're both like pulling the same amount of force, then it's going to be even. It's going to be balanced. If you are pulling me more, if you're pulling more and I slack a little bit, then I'm going to go towards you, right? That's what's happening in the shoulders. It's rounded forward. But if I was to if I was to reactivate and then pull a little harder and to match your force, then it would be balanced again. Right? Same concept. So that's the common sense that I guess I want to talk about. Okay, next question. My doctor and physical therapist told me I have shoulder impingement, which is a super common term that doesn't mean much. It hurts when I raise my arm, do shoulder or bench presses, any overhead activity. It sucks because I cannot carry and hold my kid due to the pain. I've gone to many practitioners, gotten all types of work done to release the lesions and the tightness, but it doesn't. But it helps, but it doesn't completely go away. I would re-aggravate it more when I start working out again and pushing more weight. How will muscle testing help me? Well, sir, this is what's going on is that when things don't go away, we got to start looking deeper. And so in any overhead movement, for instance, like if the shoulder is getting pinched, I'm thinking like pecs, I'm thinking like anterior deltoids, right? Maybe the subclavius muscle down here, the pec minor. By the way, no one talks about it. The subclavius muscle, it's actually really important. Or the bicipital tendon that connects the bicep. Like all these structures here and the rotator cuff muscles are involved when we talk about shoulder impingement. There's just way too much here to just diagnose you with something and then give you a cookie cutter way to fix it. So what I would do is I would test which muscles aren't functioning right. Chances are the things that are tight are functioning fine, but it's probably the muscles in the back, again, that are not functioning well. And when I think about shoulder impingement, sometimes the shoulder comes forward and up and rounded and it pinches everything up here, right? That could happen too. So I would I would be willing to test or say, I'm just guessing here because I'm not testing, but maybe the lower traps are not firing, right? Maybe the external rotators, maybe the teres minor, are not firing correctly. So, and the infraspinatus. Um, and those can cause issues. We want to think about, like, if you have pain somewhere, it doesn't mean that's where the problem necessarily lies. If you have pain, that's like all your muscles being overworked. Think about it. So if you have like a group of workers, your employees over here, right? You got 10 employees over here, and 3 of them decide to not work. So 7 of them have to, you know, take that load, right? And then two of them is like, well, I don't want to work again. So 5 of them decide to not work, and then now you have 5 people that are doing twice the amount of work. That's what's happening in the shoulder girdle. That's what's happening with these muscles. So when when those 5 that are working really hard overtime, double overtime, they're going to eventually complain. They're going to burn out. They're going to break down. They're going to have illness. That's what's happening with these muscles here. Is that they're going to tell you that there's something really wrong here, and you need to get something fixed. And they tell you by pain. Pain is just your brain recognizing that there's something wrong, that there's an issue, right? So when there's a pain, it's an indicator, it's a signal. Pain doesn't tell you that what the problem is, right? So it's our job to go there to use muscle testing to find out what the root cause of that problem is, because pain is not a reliable indicator. When there's pain, it just tells us there's something wrong, and then that tells us that we need to dig deep. So chances are you've had so much of these therapies that are done at that local area that you have pain, but no one has really looked at what all the other muscles are doing, like your subscapularis, like your serratus anterior, your lower trap, right? How are all those shoulder scapular stabilizers doing? If they're not functioning well, or if they're not doing their job, it's going to require too much toll, too much tension on all the other muscles. And then eventually you're going to have pain, and then you're going to have impingement, you're going to have inflammation, you're going to have swelling, adhesions that build up, right? So, yeah, so hopefully that answers that question there on shoulder impingement. Diagnosis is really just a diagnosis. It doesn't tell us that much, right? But if I can assess you in real time to see what's functioning and then to check what is going to turn those muscles back on, almost all the time when we turn those muscles back on, there's at least a 50% reduction in pain. Why? Because you've taken tension away from the areas that hurt, and they're going to stop screaming at you. It's kind of like a breath of fresh air, right? It's a relief. So, and then over time, as we keep activating, keep rehabbing, keep doing the things to support the body and allow it to heal itself, then pains will eventually subside. Better function will restore. One thing I know for sure is that sometimes a lot of times people after a session they're like, I still have a little bit of pain, and I say, yeah, it's fine. Your nervous system will reset itself. If my mentors have said, if your muscles fire correctly, if they function well, then I know that all is good. Things will sort itself out. Just let the body do its thing. You know. So yeah, so hopefully that answers those questions about the muscle organ relationship. What's the difference? Muscle testing is not really a therapy; it's a diagnostic tool. Um, you know, there's a common issue with rounded shoulders, common issue with shoulder impingement. especially a lot of people pushing a lot of weight. You know, I used to be a weightlifter myself, so I know what shoulder impingement feels like, or the pain that you feel when things are just like pinched and you can't raise your arm up and it just pinches right here. For me, it was for me it wasn't this. For me, it was like lower traps and a lot of the stuff that, you know, in my the shoulder stabilizers weren't firing correctly, and so we had to find ways to fire it correctly. They were related emotionally, they were related nutritionally, and of course, I had to get neurologically, you know, reactivated. I had to get soft tissue work done, all of those, the whole shebang. We have to do the whole shebang, but always in a priority. So hope that answers your question, your guys's, and thank you for sending in those questions. Thank you for the awesome feedback, and hope this was valuable to you guys. If you guys like to know more, if you guys like me to cover any more topics on anything and just provide a different take on health issues, then let me know. Shoot me a DM, send in your questions. But thank you guys. Have a good one.